We now move on to question 92, which has been asked by the Honourable Clerk to the Minister of Health. The question is on funding of the National Health Insurance. The Honourable Minister.
Thank you, Chairperson. Honourable Member, let me start by correcting something that is grossly wrong in the question. The National Health Insurance never made any proposal whereby each South African will be provided with same quality of healthcare only under private healthcare, as your question suggests. What the NHI proposes is that all health facilities, public and private, have to be accessible to all South Africans if and when their health needs demand it. But this must be done, obviously, in an affordable manner. Now, let me deal with this claim of 1.3 trillion. You are aware, honorable members, that 1.3 trillion is the total budget of the government. Now, the publication of this number is disingenuous and deliberately circulated to anger the public because it will sound crazy for the state to introduce a health financing system that will cost the same or even more than the total budget of the country. You know, Chairperson, this calculation, I've described it in certain terms and I want to repeat it here. I said the person who did it was practicing mathematical hooliganism. Because of the manner in which it was calculated. It's mathematical trickery. You are tricking people. For those who don't understand, it is similar to if a minister of housing stand up and say, all South Africans need to have shelter. Nobody can challenge that. Somebody goes to Sandton or Bantry Bay here and you take the most expensive house in which a billionaire lives and you multiply it by 69 million, 61 million people and you say this is what the minister is proposing about housing of South Africa. That's exactly what has happened here. And that's why I called it mathematical hooliganism about the person. And the person who made this calculation is obviously an interested party because he's making a lot of money from the healthcare by being a medical aid. So this is wrong. Now, this calculation also makes a very wrong assumption that we are going to abandon all public clinics, all health centers, all ordinary hospitals, all academic hospitals, and general practitioners, and go only to private hospitals. How possible is that? Now, your last question is the impact this calculation will have on taxpayers. I cannot, in my right senses, investigate impact about something that does not exist and is not going to exist.
Can the Minister please advise what the cost of the massive NHI roadshow was, both in total and per region, the specifics of its funding within the department's budget? This would be detailed as a specific project funding related to the NHI initiative. And can the Minister please advise us under what section the budget was used? Why were many civil society groupings and private medical stakeholders not included in the current roadshow?
I've never excluded anybody. I've got a list. I've got a list of people who have invited me to go and address them. I've been to churches. Tomorrow, I've been called by the media. There's a debate about NHI. I'm going there and I don't owe you any explanation why I go there. I will go. I've been called by Contralesa. I'm preparing to go to them. I was called by churches in Limpopo. I'll go to them. If you call me, I'll even come to a house and talk to you about NHI. And I'm not going to explain the cost to you. So I am not going to entertain what you are saying. I'll go out. Every minister is allowed to do so. Why don't you ask all the other ministers when they go and talk about housing, water, social development, education? Why are they
Honourable
not
Minister, your time is up.
No.
Inform South Africans today for once and for all where the funding of the NHI is going to come from. If not, why not? And if a minister really believes that already overburdened taxpayers will simply accept another form of tax to fund the NHI. Thank you.
So when we want to treat South Africans, even those who are poor, we are saying where will the money come from? I'm not going to answer that question. Money in this country for housing, for water, for police, for the army, to run parliament, pay your salaries. Where is it coming from?